Hello, everyone. How are you feeling this evening? Okay, welcome to the Befrienders. Can I ask maybe y'all to mute your... How are you feeling this evening? Okay, welcome to the Befrienders. Can I ask maybe y'all to mute your... How are you feeling this evening? Okay, welcome to the Befrienders. Can I ask maybe y'all to mute your feeling this evening? Welcome. Hello. Okay, there's someone. Can I ask maybe y'all to mute your feeling this evening? Welcome. Hello. Okay, there's someone. Can I ask maybe... Hello. Are you able to hear me now?
Yes.
Yes.
Okay. Okay, let's start. So sorry for the technical difficulties earlier. Yeah. Welcome everyone to the Befrienders KL public webinar on mental health issues. Yeah. So today's topic is, I would say, very relevant now. Yeah, on self-care. I would like to ask y'all. Yeah. Have you ever felt so overwhelmed with work, with assignment, or taking care of others that you feel like I just need a break or I need some me time? But then you don't know what to do for yourself. Or when you're doing something nice, even then you feel guilty about it. So why are we feeling that way? So what is self-care? Is it being selfish? Right. So we are very privileged to have a very special guest speaker today to talk about self-care and teach us more about self-care. Yeah. Brief introduction of our speaker today, Dr. Lim Poh Khuen. Okay. Dr. Lim Poh Khuen is a psychiatrist in the Department of Psychological Medicine, University of Malaya. She completed her Masters of Psychological Medicine at University of Malaya. She is the VP of Care Warrior Association, an NGO which is committed to assist in mental health advocacy, in particular, mental health awareness and suicide prevention. Dr. Lim is also very passionate in raising mental health awareness, and in her free time, she indulges in art. So can we all put our hands together for Dr. Lim? Dr. Lim, are you there? Yeah.
Yep. Hi, Kenny.
Hi, Dr. Lim. How
Hi,
are you?
good to see you online again.
Yeah.
Right. So thank you very much, Kenny, for the kind introduction. And shall we start today's topic?
Yeah, sure.
Okay.
You are going to share your slide, right?
Right. I'll share my screen first.
Okay.
All right, I think Kenny, you all can see my screen, right? Can you see my screen, Kenny?
No. No screen.
No screen. Hang on. Okay, let me try again. Hang on. Okay, I think you can see the screen now.
Yeah.
Right. Okay, so I hope that the screen is working now. And first of all, thank you to all of you for joining us today on a Friday evening on this topic of self-care. Before we start this topic, I would like to ask all of you a question. Do you take care of yourself? If the answer is yes, what did you do to take care of yourself? And when was the last time you did something to take care of yourself? So there is this myth created by the self-care industry and on social media that, self-care is a day in the spa, or it's a weekend Netflix binge, manicure, pedicures, bubble bath with candles and roses. All these indulgences are great, but they may not be self-care. And we are left chasing these self-care experiences that do not restore us. So now we are left with one question. If those things are not self-care, then what is self-care? Self-care is deliberately taking care of ourselves. It is the ability to refuel and refuel ourselves in a healthy way. Self-care is important for us to maintain and promote physical and emotional well-being. Who needs self-care? It's actually you. All of us do. We need self-care because self-care is central to living a life that makes us feel good and that we feel good about. And yet, many of us neglected this very important behavior to take good care of our mind and body, to protect, maintain, and improve our physical health. Often, when we reach our 40s and 50s, we will have increased chances of becoming ill later in life. We might think, perhaps I should have not eaten McDonald's just now. I should have stopped smoking, and I should have signed up for that yoga class. And all these small things are things that can add on to an unhealthy you. So why is self-care so important? Because there's only one you, okay? And you can make better choices today to have a big impact on your health. It's not easy to make a change in our busy lives, but the good news is that you can do something about it. It is about making a choice today to do the right thing, starting right now. So I think that is why all of us are attending this session today now to learn more about what is self-care. So in a nutshell, self-care is about taking care of yourself and looking after yourself. It involves being aware of and being connected to yourself. It is about how you can make changes to fit in your life, how you can put effort to choose a healthy lifestyle. And remember that self-care is not something that you just tick off your checklist. Oh, last weekend I went to Port Dickson, so I've done my self-care. No, okay, you must remember that this is something that requires perseverance to make it eventually a normal part of your life. And every small change that you make today will transform your life. So living in this society where we have a lot of demands, we are faced with a huge amount of pressure, and a lot of people say they feel stressful. We thrive on performance, we compete with each other, we want perfection, and all this leads to insidious increase in stress. When we browse Facebook or when we talk to our colleagues, we hear them saying that, oh, I'm very stressed today. I'm so stressed with my husband. He's like this and that. So stressed with my kids. School has started now. Even children who are going to school feel stressed. What does stress really means when people talk about stress, and how does it affect our physical and mental health? To simplify, stress is a normal body reaction where we react physically, mentally, and emotionally to pressure from a certain situation or event. We can't say that we have no stress at all. Stress is a part of our lives, and there are many things that can lead to stress, such as having personal matters. Okay, if you are ill, or for example, if you have been diagnosed with some medical problems, now it's COVID-19, you might feel stressful about it because it affects your family, your friends, and people who you came across with, your employment as well. And now, financially, a lot of us are faced with financial problems. People lost their jobs. All this could be contribute to personal factors of stress. Next, relationships like family and friends, getting married, divorce, breakups can lead to stress. Those who are working, is okay. Those who are working or students sitting for exams, any issues with employers, all this can lead to stress, as well as housing problems. Don't neglect this fact where some of us have problems with our neighbors, for example. So all these are the things in our life that causes stress that we may or may not notice that it's happening to us. Is stress good or bad? And what do you all think? Have you thought about it? We often need some small doses of stress that can give us some positive effects. So, for example, what we call a good stress, those are the stress that will keep us motivated and help us to accomplish tasks more efficiently. For example, you want to sit for an exam, you need some stress to help you, push you to study harder. When you receive a promotion at work, it is a good stress for you to challenge yourself, or planning on a vacation. However, when there is too much stress, it can be detrimental. And this, or what we call as a bad stress, can result in various physical and mental health problems. How does that happen? Okay. When we are faced with stress, our body secretes a stress hormone called cortisol. This cortisol is important because it helps us to fight stress, help us to survive. But here's the problem. When we are exposed to constant stress, and over time, your cortisol would be too much in your body, and our system gets overworked and we crash. And this can lead to weakened immune system, heart disease, high blood pressure, high blood sugar, digestive issues, nerve problems, and for mental health, common mental health issues such as anxiety and depressions. And of course, when the stress continues on, it will cause us to have distress, especially when the demands in our life it's much higher than how we are able to cope with the problems. If this is not tackled, it may lead to impairment. And for those who are working, it can cause burnouts. So the World Health Organization has defined burnout as a syndrome resulting from chronic workplace stress that has not been successfully managed. And it's characterized by three dimensions, which is feelings of energy depletion. You feel that you are not motivated to go to work, you are always tired, you cannot be as efficient as before. All these are signs of burnout. How do you know that you need to slow down? Our body is really smart. When we are faced with stress, when we are faced with threats from outside, our body sends signals to us to tell us, hey, you've got to slow down. But if we do not recognize these symptoms or signs, then we would not know that we are actually facing huge amount of stress. So these are the few signs or symptoms that you can see. For example, in physical body, you may experience general aches and pains all over your bodies. It could be neck pain, headaches, feeling tired, more tired than usual, getting tremors, palpitations, cold and sweaty palms, and a lot of them experience sleep problems. For example, you can't fall asleep anymore like before, or you keep waking up after you fall asleep. Behavior problems that you can see are such as absenteeism. You find yourself difficult when it comes to making decisions. You lose focus easily. Sometimes you see your friends or maybe your family appears to be easily irritable over very small things, get angry, feeling anxious, nervous. All these are signs that you are experiencing stress. And most importantly, psychologically, you can feel low mood, feeling depressed, fatigue with excessive worrying thoughts, feeling anxious, and if not addressed, can lead to mental health issues or disorders like depressions and anxiety. Right. So now we arrive to the main focus of today's topic, which is types of self-care. What are the types of self-care? When we say self-care, what are the domains? In general, we can see that there are six domains: the physical domain, psychological, emotional, spiritual, personal, and professional. We will zoom into this one by one. Physical self-care, what can we do? Not necessarily we must run 30 minutes every day or climb Mount Kinabalu. You can even be as simple as just taking a walk, doing yoga, even if it's just 15 minutes, getting a good rest, a good night's sleep. Very importantly, choose to eat healthy food that provide us with essential minerals, vitamins that can help to keep us fit and healthy. As for psychological self-care, first, very importantly, minimize social media use, especially in time of pandemic now. We know that everyone is busy browsing news. Oh, how many COVID cases my housing area has? Is this a red zone now? Check which neighbor's house has COVID and try to avoid the place. All these news will cause anxiety and it will sometimes resulting in us having more worries on issues like COVID-19. Minimize social media use is one of it. Reading a book, try a new hobby if you like. Journaling is one of the ways as well that's quite useful. Meditation, and look here, counseling and psychotherapies are also forms of psychological self-care. So if you really need any help, step forward and seek help from counselors or any psychologists. Next, talking about emotional self-care. What is emotional self-care? Emotions, right? It's talking about feelings. So the activities that you do in emotional self-care are activities that help you to acknowledge and express your feelings on a regular basis. Imagine that if you have a balloon and every time you experience some negative emotions, you fill the balloon up with air. What is going to happen if you do not let the air out? The balloon might burst, right? Same like us, if we keeping all the negative emotions, the uncomfortable emotions in our body, it will be detrimental for our mental health. Hence, activities like talking about your feelings. If you have nobody to talk to, you can always call Befrienders. Self-compassion, having self-love, watching a good movie, and some say positive affirmations. Okay. As for our spiritual self-care, does not mean to say that you must have a religion to achieve spiritual self-care. It can be as simple as meditating for 10 minutes, right? Praying, reading inspirational work, or getting in touch with Mother Nature, and things such as practicing mindfulness. Personal self-care encompasses hobbies, knowing about yourself, honoring yourself, and knowing your personal identity. At the workplace, one of the very important skills that we can learn for self-care is to learn how to say no. It's sometimes very difficult to reject your colleague's help, but knowing that helping your colleague will cause some inconvenience to you. So we have to learn how to say no, learn time management skills, leave work at work. A lot of times we go back and we check our emails, we look at our WhatsApp group messages, what are the things that we haven't done, what we need to do tomorrow. So if you are an employer here, maybe you can consider minimizing texting in a WhatsApp group after working hours. Okay, taking time for lunch, have a good lunch, and if you need, take mental health holidays. All right, so those are the self-care activities that based on the 6 main domains. And let me share some self-care activities. So what are your self-care activities? If you have any self-care activities that you like and that you used to do, you can type it out at the comment box. I see Wen mentioned meditation, right? Santa mentioned yoga. Because a lot of time, self-care is not a one-size-fits-all. Okay, maybe yoga is suitable for one person, but not suitable for you. So if you have not find your self-care activity, don't give up, continue searching for your self-care activity. Okay, Karen mentioned weekly journal. Yes, so keep the ideas coming in. At the same time, I would like to share some of my self-care activities. Okay. Now, after understanding self-care, developing a self-care plan, we need to put the self-care plan into action. Okay. So remember this. After this session, you could start having a self-care plan based on the domains and see what you can do, even if it's just 5-10 minutes each day. Okay, as for me, what do I do is that one, eating healthy. Okay, I know that a lot of us can't. My friends used to comment to say that the food does not look appetizing, but I think it's healthy food. Eating healthy. Of course, sometimes you indulge in things in foods like this. Exercising, going for even just a brisk walking, jogging, right? Keeping in touch with Mother Nature. Or if you like riding horses, you could do it. And personally, I love art. So in my free time, I would try to spend some time to paint something, experiencing with different mediums. Or it could just be a visit to an art gallery. And I really loved being in the city. So simple things like walking around the park, watching a sunset, all these things are my self-care activities. Journaling is something that I love to do as well. It helps me to reflect on my week, my day, and to plan on the coming week. And those of you who have pets at home, all right, talking or cuddling your pet, petting your pet is also a self-care activity. And now since it's the COVID-19 and we are on lockdown, before this, I've cultivated this new hobby of planting succulents and Fittonia. Okay. So, okay, the last one that I would like to share before I end this is mindfulness. Some of you may have heard of mindfulness. Some of you have not heard of mindfulness. What is mindfulness? Mindfulness means purposefully paying attention in the present moment without making any judgment. So if you know how to read the Mandarin character, you can see that in Mandarin it is called Nian, and it's made out of two characters, Jing, which is now, present, and Xin, which is heart. Do you know that an average person has about 15,000 to 65,000 thoughts per day? And of these thoughts, 80% of the thoughts are mostly negative. And a lot of times we are living in the past or the future because of all those thoughts that are in our mind. Practicing mindfulness brings us back to the present moment and to be aware of our senses, our emotions, and things that we are doing. And one of the mindfulness practice that is simple is breathing. You can just take 5 to 10 minutes each day to do breathing, and you will see the benefit of it. Okay, so now I would like to invite all of you to share a few minutes of your time to do this mindful breathing meditation together with me. Okay, so let's start. Okay, make yourself comfortable. You could be sitting or lying down, it's okay. If you are sitting, then place both of your feet on the ground and your palms on your lap. You may choose to close your eyes if you want to. And as your body settles, bring your awareness to your breathing. Notice the breath coming in and the breath going out. Follow the breath with your awareness. Follow the breath all the way in and follow the breath all the way out. Not trying to change it in any way. Breathing in, feeling the breath as it passes through your nostrils. Breathing out, feeling the breath as it leaves your nostrils. Breathing mindfully in the present moment. Breathing in, I know I am breathing in. Breathing out, I know I am breathing out. If thoughts come into your mind, acknowledge the thoughts without judgment and let them go. Let them drift away like clouds floating across the sky, and bring your awareness back to your breathing, back to the present moment. Breathing in, I know I am breathing in. Breathing out, I know I am breathing out. Continue to breathe mindfully. Notice the gap between the in and out breath. Each time you are distracted by a thought or maybe something that is bothering you, notice the thought, acknowledge the thought, and then let it go. And bring your awareness back to your breath, back to the present moment. Notice the familiar rhythm of the breath. Breathing in, I calm my body. Breathing out, I smile. As we bring this meditation to an end, take a moment to notice how you are feeling. Your body, your mind. If you like, offer gratitude for this time you have taken for yourself to be quiet, to breathe. Slowly come back into the room, aware of your body on the chair, and open your eyes whenever you are ready. Okay, so this is a simple mindfulness breathing exercise, and congratulations, you have done your few minutes of self-care today. All right, so lastly, what I would like to share with all of you is that remember, we have to take good care of yourself so that you have space to care for others. And thank you very much. I'm going to pass it back to Mr. Kenny.
Thank you, Dr. Lim. That's very, very good sharing of the different types of self-care that we can practice for ourselves. And I really like when you say that, self-care is something that we need to put in effort and make it, a habit. Yeah. Thank you.
Yeah, that's right.
Yeah. Right. So we'll move on to Q&A session now because during registration, we have collected some questions. And I believe we have a special guest with us today, Dr. Lim.
Yes.
Yeah, is the special guest ready to join us? Can we welcome? Yes, Dr.
Hi,
Amir.
how are you?
Hello, Dr. Amir. How are you?
Good, good, thanks. How are you, Kenny? It's been a while.
Yes, it has been a while. Welcome and thank you so much for taking I'm sure you're very, very busy, taking your time to be with us and to help answer some questions, some very interesting question. Yeah.
Yep, no problem at all. Congratulations, Dr. Lim. That was a really good talk. I really enjoyed it. I almost fell asleep doing the mindful breathing exercise just now.
I don't tell you. I think that must be showing that you must be so tired after the whole week.
All right. Okay, we will start with the first question. So the first question is, how does one practice self-care when one is overwhelmed by personal and work issues? For example, parents arguing at home. So, Dr. Amir?
Yep. Yeah, so I think just like Dr. Lim mentioned just now, it's really important for all of us to, number one, focus on self-care because it's really an activity that you could actually do to prevent mental health issues. It's also definitely one activity that you can use to maintain your mental health, particularly if some of you here are seeing somebody for your mental health condition. So I think the first important thing that we need to focus on is prioritizing self-care. And what you can do if time does not permit or you're really busy is to actually schedule it in. I tell my patients that if you're expecting to do the domains that Dr. Lim had shared with you just by passing, that means you tell yourself, today I'm going to do 2 days of exercise, but you don't list it down. I'm going to meet a friend, for example. I'm going to go for an art gallery show. It doesn't help very much. You've got to really put it in your diary so that it becomes part and parcel of your life. We are actually doing a behavior change. So definitely this will take a little bit of time, but trust me, if you incorporate it in your day-to-day practice, definitely it'll be much easier. And again, you don't have to do it every day, but at least have a activity per day or every other day. That will definitely help. You were saying just now that I'm quite busy. Yes, I am, but I actually do prioritize self-care because I know it's going to be really helpful for me to sustain doing the work that I do for mental health and others.
Yeah, and I think a lot of us who said that, we are so busy, but if you check your phone and look at the settings, you can notice how many hours you spend a day browsing on your phone. I think it could be easily 4 to 7 hours. I know I'm guilty of that as well. So those times that we spend on our phone, if you could just take 5, 10, or even 15 minutes to just do a very simple breathing exercise, that is already good enough. That's a self-care. Yeah.
Yeah, that's definitely so. I thought for 1 minute there that you were judging my phone use there, Dr. Lim.
I think we are all same here.
Yeah. So it's very important for us to basically be conscious about it lah. Like, what Dr. Ami said, put it down in the diary and then make sure, or at least try our best to do, to practice whatever that we have written down to
Yep.
of ourselves. Yeah, and also, I like the last slide that Dr. Lim shared. Yeah, basically we have to take care of ourselves first before we can, take care of others, right? Even for psychiatrists like Dr. Lim and Dr. Amir, right?
Definitely.
Right. Question number 2. I feel bad when I have my me time. I couldn't focus on myself and my mind will start to race. How do I overcome this?
Well, this goes back to what you were mentioning just now at the very beginning of our talk, where self-care is not selfish. In fact, it's really essential for us to have self-care as part of our routine, because as Dr. Lim had put in her last slide, taking care of yourself is taking care of others. In fact, we often talk about caring for self is actually the first step of caring for others. There's no point in you damaging yourself and then trying to care for others. What's going to happen is you're going to do probably more harm than good. So it's really important for all of us here, whether we are a parent or a son or daughter, employee or employer, to really take that time to put in some effort for mental health. Again, we have to remember that health incorporates physical health, social well-being, and also mental health. We really, this is probably the cheapest activity that you can do to ensure that your mental health is maintained. So it's really important for us all to put it in there. I don't know what Dr. Lim's thoughts are, but those are my thoughts.
Yeah, I think I do agree. Even I do have patients who say they feel that it's selfish for them to take care of themselves instead of spending time taking care of others. But like what Dr. Amir has said, if you don't take care of yourself, you can't take care of others. Yeah.
So that means we shouldn't be feeling guilty lah, yeah, when we practice self-care, right?
No, definitely. I think, like I said, it's part and parcel of actually helping self and helping others. I'll give you an example. If we're not doing self-care, myself and Dr. Lim, and we succumb, again, we have the risk of developing mental health issues just like everybody else. Probably the only difference is that we probably have a little bit more skill sets to prevent it. But if we don't do it, eventually our job itself will get to us. And how are we going to help people out there? In fact, some of us actually take breaks purposefully. Yeah, we take breaks. We don't have anything planned sometimes, but we know that we are starting to develop mental health issues, as Dr. Lim had mentioned, the stress, the behavioral symptoms, the physical symptoms, the emotional symptoms. And some of us actually take some time off in order to help ourselves so that we can actually help others.
That's really important, like what Dr. Amir said, right? It's essential. It should be our daily routine, yeah, taking care of ourselves, right? Thank you
Yep.
so much, doctors. Let's move on to the next question. A combination of two questions here. How do I overcome negative thoughts in my mind or negative self-thoughts? And how to stop worrying and overthinking? So I think this is a very big topic here. Dr.
And
Amir?
this is a very good question that Dr. Lim should start the discussion. Dr. Lim, thoughts?
Okay. Right. Yes, it's a very common question that we always get because, like I've said just now, a lot of time, 80% of the time, a lot of our thoughts are all negative thoughts. I guess the first step is that we have to be aware of it. Every time when we are aware that we are having negative thoughts, aware that we are overthinking, that our emotions have react towards that, we need to put a stop to that. Okay, because we know that if we continue thinking about negative thoughts or negative self-thoughts, it goes to a downward spiral and eventually it will affect our mood. So being aware is one part of it. Second, what we could do is just simple breathing exercise to be back to the present moment instead of having our mind keep thinking about what happened earlier or what's going to happen tomorrow, those worrying thoughts. I guess it takes a lot of practice, right, on how to be more aware and how do we overcome these negative thoughts. Yeah, so Dr. Amir, you would like to add on CBT?
Yeah, well, I think the negative thoughts, we often talk about negative automatic thoughts or NATs, and this is really the crux of something called cognitive behavior therapy. You don't really need to know the therapy itself, but one of the components is actually trying to know your thinking errors. So if you Google thinking errors, you'll see a list of thinking errors that will come out. Just being mindful and conscious about these thinking errors goes a long way in actually helping to reduce those thoughts that you might be having. And I think Dr. Lim has really hit the nail on the head, whereby you've got to practice after you know these errors to be conscious about them, and then start developing some skills to counter those thoughts. And I think this is where being mindful about those errors is really, really important. Also, if you remember just now, Dr. Lim also talked about one of the domains was psychological. So actually seeking help if you're finding that you're always negative, but you're not really, having a major issue like depression, for example. You just, you just feel that you're a negative person. Going for some form of therapy, whether it's supportive therapy or some level of cognitive behavior therapy, is actually a way to grow. And I remember when I was in training, going for this therapy mainly to actually learn a little bit more about myself as I go through the training. So you don't actually need to have a mental health issue per se, but if you have some problems and you feel that these particular skills might be helpful for you, you can actually either do some bibliotherapy, we call it, reading up on this. There are some self-help courses out there. And again, we've got counselors and clinical psychologists that might be able to guide you in helping you with these cognitive errors or thinking errors.
Okay. Right. So going for therapy shouldn't be looked at with stigma attached to it, right? Because now even people who are struggling with mental health issues, it's difficult for them to step out of that and to seek for help, yeah, because of the stigma.
Definitely, definitely, Kenny. I think we have to move away from thinking that you go for therapy only when you're unwell. Actually, the counselors do a really good job in almost like coaching, in assisting you to actually get better. In fact, if you think about coaching per se, whether it's business coaching or self-development coaching, it is a form of therapy. It's just that the ones that we often equate with clinical psychologists, particularly, or psychiatrists, is going to be therapy that is used for individuals who are struggling with their mental health. But some of us, in order to, lead more successful lives, actually go for some form of therapy. In fact, like for example, for at least for myself, we also go for indirect kind of therapy in order for us to manage the cases that we sometimes see, especially if you've had a really long week of cases, which sometimes do get to you. And I'm going to admit it here, Kenny, that we're also, again, like I said, not immune to developing mood symptoms because of the work that we do, and support from colleagues. It's just that we call our therapy peer group sessions, where we discuss about cases, and we sometimes debrief about cases, debrief about how we're feeling as well, so that we can then be able to assist the next person that comes into the room. So it's really important even for us to spend that time together in getting that kind of therapy. That's what it is.
Yeah, so becoming aware of how we are feeling is also very important, right? Because I think both of you mentioned it's important to be aware and then to be mindful, to be conscious about our thoughts, especially all these negative thoughts, right?
Yep.
Are there any ways that can help us become more aware of our feelings? Because sometimes we are so used to it, right? Negative thoughts.
It's often the problem is often about, number one, validating that you have a feeling. It's really important for us, especially for children. They don't know what they're feeling, right? So actually putting a name to it goes a long way. In fact, there was this new, I don't know whether you saw the New York Times, that article about how we're feeling during the pandemic, and they put a term called languishing. So actually naming that meh or blah, or that feeling of fatigue, emotional fatigue, goes a long way in actually helping individuals to actually recover, because they have a name for it. And same thing with our emotions. If we're feeling angry, knowing that we're feeling angry is the first step. And then what do we do about this anger? If you're feeling sad, knowing about, knowing that it's sadness goes a long way in actually for us to deal with the sadness. It's when we deny those emotions, as some of us do, that's when it becomes difficult, because you're struggling, yet you don't want to acknowledge that you're struggling. So how are we going to then look for help as a result?
Yeah, I agree. I mean, I guess if we could just give a really simple example, for example, if I did not get the promotion at work, I would have some uncomfortable feelings inside me. I would then be aware that, yes, I'm feeling sad now, right? I would embrace the feeling, acknowledge the feeling, and embrace the feeling of sadness, instead of trying to avoid it or trying to keep coming up with reasons like, no, I think it's the wrong decision. I shouldn't be upset. I'm not good enough for the job. Instead of having those kind of thoughts and feelings, accept that we feel sad, write with the emotions, and embrace it. Yeah. So that's part of being aware of it.
So it's important to just be honest with our own feelings and then accept it, right? Validating the feelings, right? Thank you so much. I think a very, very well answered question. Yeah, we'll move on to the next one. How does one become more aware of burnout, and what are some of the advices for burnout caregivers? I think this is very relevant to our kind of work also, I mean the Befrienders, and I believe that we have a few volunteers who are in this session now. So, doctors?
Dr. Lim, do you want to take that?
You can start first. I'm feeling burnt out from the webinar. Just kidding.
So I think first of all is knowing that burnt out is probably one form of distress. It doesn't necessarily mean that the person is impaired. What it does mean is that that person is struggling with the job at hand, and often burnt out is related to working or some kind of repetitive or continuous work. So you're going to have those three symptoms that Dr. had mentioned just now: disengage. You're going to have some emotional, manifestation of you're feeling, and you're probably not going to be enjoying, or you're going to see a performance decline as a result of it. So I think the first thing is to understand that this is not depression, but this is beyond just feeling empty. This is actually burnt out because it's very much related to work. And often what happens is that it'll just be very specific for work. For example, if you're talking about caregivers there, Kenny, if you're not caring for the person that you're caring for, you're actually quite okay. Is that when you have to do the task, then you start to feel all those emotions that we were discussing about just now. So the treatment for this is quite simply to take some time off. And that's why, for example, if we have caregiver burnt out for Alzheimer's or dementia, for example, dementia centers in the past, well, this is pre-COVID, would be able to take your family member for the day so that you can actually have some time to recharge. And we often, at least myself, I often ask my patients who are caring for chronic illness, patients like schizophrenia, for example, or dementia, whether their caregiver is feeling okay, because we acknowledge that they can undergo burnt out, and therefore providing some ideas on how to take some time off. Again, making sure that they don't feel guilty for that time off, because it's really important for them to take that time off, will go a long way in helping people to actually alleviate burnt out. For friends over here who are working, if you're finding that you're having burnt out at work, this is where you need to take those annual leaves. Those annual leaves are not meant for you to save for a golden handshake. They're actually meant for you to actually take to prevent you from actually developing burnt out. And again, if leaves are not enough, you've really got to talk to your superior in order to find ways to mix and match the work that you do, so that it becomes a little bit more manageable, especially during this COVID pandemic period.
Or you can actually make an appointment with Dr. Amir, or call Befrienders, right, Kenny? Yeah.
Anything to add, Dr. Lim or Dr. Amir?
I think no, but I think one of the points that Dr. Amir has mentioned is very important, is don't feel guilty about admitting that you need help. A lot of time it's because, for example, lack of communications between family. Let's say the family is the caregiver, because anything can cause a change in the family's routine. So this change in the routine, for example, maybe the person, like a mom, has to take up multiple roles as a wife, as a mother, maybe taking care of other people as well. So all this can cause burnout. So if you can't cope with it, try to reach for help, see what social support you could get. Talk to someone. Do not take everything and do it yourself, and then you get burnout from it. Yeah.
I fully agree.
So basically, again, be aware of it ourselves, and then when we realize that something is not quite right with ourselves, it's important to reach out, get some help, like what Dr. Ami say, take time out, utilize your annual leave. Yeah.
Yep.
That's a very good reminder, Dr. Amir. I have been keeping mine, so maybe it's time to go for a break.
Trust me, Kenny, we're all doing the same.
Yeah.
Especially I think I know the job that you're doing right now, it's really in need. So I definitely can understand that. You guys must be overwhelmed with calls.
Yes. Thank you so much, Dr. Amir. Okay, let's move on to the next question. We do have quite a bit of interesting questions here. How to open up and share my problems? I always feel stuck and I handle everything alone. I can only cry. I am scared. So what would be your advice, please?
So I think this goes with the campaign that we've been having over the last 1.5 years now, which wanes and goes up, which is the Let's Stop Minda Sehat. I mean, the advice is talk actually has a meaning. T is tell someone that you trust about your problems. So find someone you trust and tell someone that problem. A is asking for help. It's not embarrassing, nor is it wrong to ask for help. Everybody asks for help. I also ask for help from people. And L, for those of us who are privileged to be the person that people trust and tell their problems to, listen without judgment. That goes a long way. People don't necessarily want an answer. They just want someone to listen. I mean, that's essentially what Befrienders does. They make sure that you're being listened to, that your feelings are validated and acknowledged. And K from talk, TALK, K is also know where you can find help. And I think now there are lots of opportunities for you to find that help. The minimum would probably be Befrienders. But now in 2021, there are many other non-governmental organizations out there that are providing quite a bit of work compared to before. For example, Souls Health has a counseling service. The Malaysian Mental Health Association has a counseling service. MIASA, to a certain level, has a counseling service. And then, of course, you've got your formal counseling services, either in public or private, that you can actually go to. The easiest one being public hospitals, being one of them, or private hospitals. So, know where to find help is also one way. I think because of the COVID pandemic, probably one good thing is that there's a little bit more awareness on mental health. Sadly, the way that we came to this awareness has been through a negative route. For example, lately, we've seen a number of tragic deaths that's happened and reported, and therefore people are being more aware. Working from home particularly has led to a different type of stress for many people. Although it's positive that companies are putting forward activities, but at the same time, we would have loved it that they were more aware about mental health from a different point of view. But I think we take what we can, and knowing where to find help is one part of it. And again, these are some of the methods. Just to remind people who are in companies, sometimes your company has what we call an employee assisted program. It's private and confidential. Sometimes it's independent from human resource. So that's another, place that you can actually find help. In those from universities for students, you might have a counseling service again, which is private and confidential, where you can actually find that help. So knowing where to find help is really important.
Thank you, Dr. Amir. And thanks, Dr. Lim, for summarizing or typing out the Let's Stop Minda campaign in the chat box. Tell someone you trust, ask for help, listen without judgment, and know where to find help. That is really important. And thank you, Dr. Amir, for sharing. Because I think right now, many people out there are looking for an avenue to talk about their problems safely. So that's why many are turning to helplines as well. So what we are experiencing is that an increased number of calls since March last year. And it actually started from 2019 when MCMC gave us free calls from the 8 telcos. So from then onwards, we have already seen an increased number of calls. And then with COVID-19, it's really very overwhelming. So with all the other NGOs who are also providing helplines, right? I think it's really amazing because people can actually reach out to more avenues. They have more avenues to reach out to these NGOs to talk about their problems.
I think that's I think you brought up another really important point, safely. So again, not every counselor, psychologist, or psychiatrist are the same. Make sure that you find a safe one. So for medical doctors, psychiatrists particularly, we are registered under the National Specialist Registry. You can actually go on the NSR or the Malaysian Medical Council and find whether your doctor or therapist, has the credentials that they claim that they have. For counselors, there is actually a board of Counselor Malaysia that you'll have all your counselors also listed in there. Now, for clinical psychologists, they're self-regulating at the moment. So the Malaysian Psychological Society, if I'm mistaken, is the one that does quite a bit of the accreditation. So, make sure that the people that you're asking for help also have the right credentials, because as we know, talking therapy, as it's often called, is an intervention. It's very helpful for many people, but you really need to make sure that you have the right person that's doing the job for you, with you, together. And that goes a long way in actually helping you to get better.
Yeah, so that's very important, right? Getting the right person and a qualified person, yeah.
Yep.
But you know, at the Befrienders, sometimes we do get calls from patients, yeah, who talked about having side effects from medication, and then what happens is that they give up. You know, they as a result of those side effects, they decide to not take the medication and also not to continue seeing the psychiatrist. So, what is your advice to patients like this?
I think again, our relationship with our patients should be two ways, and the decisions that we make with them should be two ways. There should be a lot of discussion about the treatment that you are actually on. So for friends out there who have family or themselves struggling with a mental illness and are on medication which might not be the most suitable for them, it's really important that you talk to your doctor. And if you're not getting through, then you might want to consider changing your doctor as well. Because to be fair, when we're dealing with psychiatry or mental health, and this doesn't just include doctors, but also all our mental health colleagues, it's about fit. It's about whether you can work with your therapist on the problem at hand. So it's really important for you to at least understand that you have the right to change, where you seek that help most of the time. Of course, there's some services that you might have some trouble, but generally, you can actually change and find someone that you can actually work with to help. It's quite often that they might come to me. They don't seem to be gelling very well, and then they might meet Dr. Lim, for example, and there's a bit more rapport and relationship building over there. So the patient continues. In fact, we have a real case that has come to me, but seems to be gelling a little bit better with Dr. Lim. So, Dr. Lim takes over of those kind of cases. So same thing, if you've come to A doesn't seem to fit your personality. You go to B seems to not be as knowledgeable as you like. C might be the best choice. So doing a little bit of that searching might be helpful. I had a patient who's been searching for 10 years before she decided to commit to the doctor that she wants. So sometimes they might need some time. Sometimes you are quite lucky, you find the person that you want and you seem to fit, and you've got your his best or her best interest in heart, and that patient trusts you to go that journey together to get well.
So that the chemistry is very important.
Yes, the chemistry, that's the word, yeah.
Okay. So I would also like to ask if anyone, participants, if you have any question, you may want to type it in the chat box. Because I think we can maybe take one or two more questions, yeah. I will maybe move on to the last slide first, and then come back to any questions in the chat box later, right? Okay, we are actually a not-for-profit organization, so our services basically is dependent on the donation from the public, yeah. So anyone out there, if you feel like you've benefited from the session today and you feel like you want to make a donation, you can actually scan the QR code on your screen, or there's our account number there. Any amount will do, because sometimes we do get a donation of a few ringgit, and I actually suspect these are coming from our callers. And every time I see donation like this, I feel very, very much encouraged and motivated, yeah, with the work that we are doing. Yeah. Thank you so much. So any questions?
I thought I saw one question from Vincent just now, but I
okay.
can't read it on my...
Yeah. Dr. Lim, Dr. Amir, what are your thoughts or researches on why some people tend to always see their glasses half empty? Which is the more major driver, born like that, genetic disposition, or upbringing, or external influence? What are some tips for us, a layperson, to support those who may be perpetual negative thinkers, who have doubts in positive outcome or self-care?
Okay, Dr. Lim, you might want to take that one. Sounds really tough, Vincent.
Yeah, it does sound really tough, and it's a really long question. Well, for the first part, I think Vincent is asking on whether it's genetic predisposition or it's because of upbringing external influence. Um, it could be a combination of various factors. Genetic predisposition is one. For example, if there is a mental illness in the family, and you might predispose an individual to have increased risk of developing, for example, depression or anxiety disorders. And of course, we know that throughout our life, we experience many stress and trauma, and we know that from studies have shown that childhood traumatic experiences or even any traumatic experiences can affect the brain development, and this would then affect how the individual would think later on in life. And what are the tips we can give to support those who may be perpetual negative thinkers? Well, my personal opinion is that one, perhaps we let them know that we share with them what are the benefits of self-care, and we ourselves practice self-care. So when somebody sees the changes in us, then they might start to believe that, oh, hey, this is a good idea, this is actually working, and then they might want to follow what we've been doing. Or as a friend, we could also invite them to follow the activities that we are doing. All right, maybe not forcing them into it, but just sharing with them that this is the self-care activity. I'm going for yoga. Would you like to join me today? Yeah. So, Dr. Amber, you'd like to add on for?
Yeah, I fully agree. I think showing that it works is really important, and that's why I took the trouble to share with you that I actually put in the time to do self-care. Dr. Lim has really hit the nail again on the head properly, where it could be a combination of all those factors. Definitely upbringing can play a part. We know that in terms of development, the environment also contributes towards this. So if an individual is consistently being told that this person is not good enough, the person will be learning to believe that that person might not be good enough, even though that person is doing extremely well from the eyes of people like us who are not in that particular family, for example. So it's a combination of all of those things that Dr. Lim had mentioned, and also the one that you've mentioned, Vincent.
Right. Thank you so much, doctors, for the answers. Yeah. There's no more question. I think we're at the end already. Thank you so much, Dr. Lim, for the fantastic presentation, and both Dr. Lim and also Dr. Amir for answering those tough but very good questions. I think we all learned so much from today's session. I think what I can summarize from today's webinar session is that, of course, there's a lot of things that we've learned, yeah, but I think what is very important here is to know that self-care is important. It is essential part of us. It's something that we need to practice, and it's something that we need to practice before we can take care of others, right? So we always start with ourselves. Yeah, so again, thank you very much, Dr. Lim, Dr. Amir. And one last thing, yeah, I love your t-shirt.
Yeah, I know. I know, Kenny. Look at that.
Okay. Yeah, so I hope we can do this again soon. So are you up for it, Dr. Lim, Dr. Amir?
Certainly, Kenny.
Yeah,
Anything for you, sir.
Yeah. Okay. So again, thank you very much. Also, thank you to the participants for staying with us. Yeah, up to what past 10 o'clock right now. So thank you so much, and we'll see you again soon.
Thank you. Thank you, everybody.
Everyone. Thank you, Dr. Amir. Thanks, Kenny.
Thanks.
Good night.
Good night.